Welcome to Trial Site News podcast series. We are excited to have Dr. Wyatt West here with us today. Dr. West will be discussing the obesity crisis and the issues that come along with it. A bit about Dr. West. He is a primary care doctor at Tanner Clinic in Roy, Utah. He leads their Mountain West weight loss clinic and helps those who struggle to lose weight and get the weight off in a healthy manner. So, Doctor, thank you for joining us on our program here today.
Oh, well, thanks a lot for having me.
Oh, it's our pleasure. We're excited to have you here. And before we get into deep into the obesity crisis, I'd like our audience to get a better picture of who you are and what you do. So, Doctor, if you don't mind sharing with us, what made you want to become a primary care doctor and specifically dealing with weight loss?
Sure. In medical school, we do a lot of rotations with a lot of different specialties. And as I was doing those rotations, I found that I really loved seeing kids, but I didn't want to be a pediatrician only because I really loved seeing adults. And I really loved seeing men and women, so I didn't want to be an OBGYN. And I really loved all these different aspects about medicine, and I couldn't picture myself just doing one thing and dealing with just one type of person. And so primary care, specifically in family medicine, just seemed like a real natural fit for me as I got into these rotations. And so that's what I did. And as I was going through my training and then into the first couple years of practice, I found that everything I was doing, so I would see a person and let's say it's a 50-year-old guy, came in for their regular 50-year physical. We did some blood work, and lo and behold, they have prediabetes or diabetes, and they didn't know about that before. And their blood pressure's up a little bit and maybe a little bit overweight, on and on and on. And as we would start treating them, as I would start prescribing medications and therapies, oftentimes they had a lot of side effects from the medicines, and they felt worse, not better. Even though all their numbers were getting better, they didn't feel better. But once in a while, one of these people would say, hey, I don't want to live this way. They would get on a real strict diet. They would start exercising. All of a sudden, they were dropping weight. The blood pressure got better, and we were taking away blood pressure medicine. The diabetes went away. They felt better. And so as I saw this happen in several people, I thought to myself, gosh, maybe that's what I want to do, is help people get to that point where we're taking away medicines, not adding more. They're becoming healthier. And on a personal note, was kind of actually my experience in my life. I grew up pretty overweight. At one point when I was a teenager in high school, I kind of got to I thought, this is not who I want to be. And I reinvented myself, and I started eating better, and I started exercising. I lost a bunch of weight. It really skyrocketed my self-esteem. And so kind of the combination of those experiences kind of led me to this point where I thought, I'd really like to focus on treating people for their obesity. And I find that's an underlying problem in most of their other medical problems. And as that gets better, they get better. It kind of just went from there.
Well, I love it because we always want to get better and eventually move on from different medications. So that's inspiring stuff. And was that the inspiration then for Mountain Valley Medical Weight Loss Clinic?
Yeah. So as I saw this happen more and more, and I started doing it more and more, I decided if I really want to get into this, I probably ought to get board certified in obesity medicine. So I did that. I started this Mountain Valley Medical Weight Loss within my own primary care clinic. And as time has gone on, it's gotten busier and busier. And so it's kind of becoming an entity of its own, which is really, really pretty exciting.
No, it is. And I took a look at your site, and it's fantastic. I so much to read up and so much to absorb. And I would highly recommend anyone in our audience to do that. It's good stuff. So let's shift gears then, and let's talk about this obesity crisis. You're an expert in this field, and we definitely want to pick your brain on this. So let's start with a basic one. How does weight affect an individual's health?
Weight affects an individual's health in so many different ways. The way I like to think about it, because I'm kind of a categories guy, I like to fit things into nice, neat little boxes. And the way I like to think about it is it affects people's health in basically two different ways, in kind of a macroscopic way and then a microscopic way. So macroscopic way, the fact that excess fat adds excess weight and excess mass affects people's health. So let's pretend that you put on a backpack and somebody loads in 65 pounds of rocks in your backpack. And you decide you're going to carry that around, walk around all day with that backpack. At the end of the day, you'll find that your knees are sore and your back is sore and you generally feel more fatigued because you carried around 65 extra pounds that day. It's not that much different when you gain a bunch of weight. People's knees hurt. It speeds up osteoarthritis. It hurts your back. Over time, that can compress discs in your back and cause pinching of the nerves in the back, which can radiate pain down your legs. It makes you just feel worn out and fatigued if you're real overweight. And so that's one example of a macroscopic effect of weight on your health. Another effect is that you are increasing this mass and it is confined underneath your skin. And so your skin stretches, the skin has problems, the skin can actually get stretched so much that it starts compressing the underlying tissues. And so people don't perfuse as well. They don't move blood. I mean, the blood is going through arteries, which are deeper in the extremities, but then they go down to your feet and they start coming back through these veins, and you're compressing the veins with this fat tissue, and it doesn't move the blood back to the heart as well. And so you start getting swelling in your legs. That further compresses the tissue. People can actually have sores that develop in their legs. The skin is just not as healthy. So that several other things that you can attribute to that are some of the macroscopic ways that fat affects our weight. Some of the microscopic ways, they kind of walk hand in hand in some ways. As we gain weight, a lot of that fat is not underneath our skin. A lot of that fat gets put inside of confined spaces in our body, like the abdominal cavity or the thoracic cavity up in people's chest. And as the fat gets stuck in between those organs, it causes that mass effect as well. All of a sudden, those organs don't get perfused as well as they used to be. And that actually can set up an environment where these organs are being under-perfused and get ischemic. So it's kind of like when you were a kid and you put a rubber band around your finger and watched your finger kind of turn red and it starts to ache. And if you left it on long enough, it'd start to turn purple because it's not getting enough oxygen. Well, the same scenario can happen inside your abdominal cavity, and it can happen to your pancreas, which sets up this inflammatory condition. So all these little microscopic hormones are being released, which cause the tissue to start to become to not function as well as it would otherwise. And you can start to develop insulin resistance and release less insulin from your pancreas. And that's what we call diabetes. Or you can fill up the liver with fat, and it raises your liver enzymes and sets up this low-grade inflammation in the liver, which can cause scarring and actually can even lead to cirrhosis. So I have a couple patients who have early to mid stages of cirrhosis of their liver just because of fat tissue that has been put in there. They've never drank alcohol in their life, but they have cirrhosis. And if it continues, if they don't change that pattern, they'll need a liver transplant. And it can happen around the heart and around blood vessels, arteries, and you get atherosclerosis and you get coronary artery disease. It sets the table for all these bad health complications because of that weight. Well, the nice thing about it is if you start to lose weight, a lot of those processes reverse themselves partially or even fully. And so that's the whole focus of a good medical weight loss program.
And it's funny you mentioned the liver without drinking, because we at Trial Site News, I do a weekly newscast, and that's one of the primary articles that's in the initial part of the podcast itself, or the newscast itself, is NASH is becoming a crisis because of the obesity epidemic right now. They're saying roughly about potentially 40 million people developing NASH, which part of those symptoms are what you were just describing, with cirrhosis as being one of the more serious side effects of it.
Yeah, exactly. That NASH stands for non-alcoholic steatohepatitis, which is basically fatty liver disease. And I'll bet you, as I just do regular physicals in my family medicine practice and check regular labs multiple times per week, I draw blood and find somebody who has elevated liver enzymes. We rule out viral hepatitis and the other more rare forms of hepatitis and do some ultrasounds, and lo and behold, there's a bunch of fat in the liver, and it multiple times per week. Now, not all of those people will progress on to cirrhosis, but when you do, cirrhosis is horrible, a horrible disease. So,
yes, it is. So, along the same vein, do people ever have health problems that cause them to become overweight?
Absolutely, yeah. Unfortunately, it's kind of this bad cycle that people get in. So weight, obesity itself causes health problems. And then there are a lot of health problems that add to the obesity. Now, there are some, in school, you learn about these rare genetic conditions like Prader-Willi syndrome and things that cause people to become obese, that there's leptin deficiency. But a lot of those problems, maybe 1 in a couple million people will get that disease. So they're really pretty rare. What is a lot more common is that people, they have some sort of health problem. So let's take arthritis of the knee. So somebody, arthritis of their knee, maybe they have a little degenerative disc disease in their back. Most people get that in their life. Well, those things cause them to be less active, which will, in the end, add to their weight problem. And then their weight problem puts more weight on those joints and causes further degeneration. So it's kind of this bad cycle. The same thing can happen in the treatment of medical conditions. So somebody becomes overweight and they're genetically predisposed to diabetes. They start to develop diabetes. Well, some of the diabetic medicines, like insulin, cause, as a side effect, massive weight gain. And then that further worsens that condition. A lot of the psychiatric diseases, the treatments to a lot of psychiatric conditions, the medications that we use to treat bad depression, bipolar, schizophrenia, things like that, one of their bad side effects is weight gain. So it can be because of the weight itself or the medical condition itself causing additional weight gain, but also the treatments, the side effect can be increased appetite. Another real common condition that a lot of women, I see this a lot in clinic, a lot of women suffer from something called polycystic ovarian syndrome, or PCOS. They have abnormal hormone levels that cause them to have all sorts of symptoms like irregular periods, growing excess facial hair, losing hair on their heads. And that's an actually really common condition. I don't know the exact numbers off the top of my head, but I would say probably 1 in a couple hundred to the low thousands of women probably have PCOS. So it's actually fairly common. And some of those hormone abnormalities really predispose them to gaining weight. Conversely, if they will lose weight, if they'll exercise regularly, a lot of their other symptoms of PCOS get better. And so it's just they have to work a little harder than the average person would to lose that weight.
I see. Well, on that same vein then, as an expert in this field, for people that are trying to lose weight, what are some healthy ways that you would recommend folks to lose weight and keep it off?
Oh, there's so many. So I think to really understand how do I lose weight, you need to step back a little bit and look at what actually causes us to become overweight. So you talked earlier in the podcast about the obesity epidemic and what that is. Well, we're calling it an epidemic because in the United States, almost 80% of adults are either overweight or obese. And so if that's not an epidemic, I don't know what is.
Yeah.
And the reason for that, we have to look at why are so many people overweight? Is it just that Americans are lazy and eat too much and whatever? And I don't think that's really true. Not 80% of Americans. And so what we have to do is step back and see, how did we get here? And really how we got here, you have to look at it in evolutionary terms. So if you and I were living 4,000 years ago, the stressors in our environment would be completely different. We'd have in order to eat, we'd either have to be foraging for food, or we'd walking behind a horse and a plow for 10 hours a day all summer long, and working really hard to get enough food to support ourselves and our families. We'd have probably regular periods of starvation. Winter would come every year. And so people got really good genetically at being very conservative with calories. When there is excess food around, we're real good at putting on fat as a energy store for when the next famine comes around. When food is scarce, we're pretty good at holding on to those fat stores that we have. And then when food becomes available again, we gain back very quickly the weight that we lost. And so people who could do that thousands of years ago, they were very successful. They had more babies, and we are the product of those babies. And so now we live in a completely different environment. We live in an environment where there is excess food all the time, where there's sugar everywhere, which sugar really packs weight onto us. We don't have to walk behind a horse and a plow for 10 hours a day. And so but we're still genetically very thrifty with our calories. And so it's kind of this setup where we are absolutely going to gain weight. And so if you want to lose that weight, you can't go back in time, and you're probably not going to move to a third world country where they still live similarly to our ancestors. And so what you have to do is you have to change your own microenvironment. And basically, you can do that through a couple means. You can do that through changing the way you eat. You can do that through changing your activity level. You can get with a medical professional and take a medicine that can be helpful, or you could get weight loss surgery. And those are basically the 4 interventions that we have in order to lose weight. And so there's a lot of, people are really concerned about their weight, not just for health reasons, but also cosmetically. And so there's a lot of money out there, and there's a lot of people that are going to offer you all sorts of products that you could buy to help you. And so I really recommend, if you're concerned about your weight, especially if you have health problems, that you get with a medical professional who understands weight loss, that can guide you through healthy ways to do that, because there are a lot of unhealthy ways to do that. In general, things that are really intense up front, where you lose a lot of weight quickly, probably are not things that are either healthy or sustainable for you in the long run to keep that weight off. And so we could talk about very specifics, but in general, slow, steady weight loss with good, healthy changes in dietary and exercise habits is about the best way for most people to lose weight.
That makes sense. And for people that have a hard time changing their eating habits, what would your advice be for those people?
Yeah, there's a lot of studies that look at that. What people are successful at changing these habits, and there are a couple common themes through the research. So people who have frequent accountability are more successful than people who don't. And so with people in my clinic, what I do is I have them download some sort of a free app onto their phone where they just track what they're eating, track their calories, they track their exercise. I also have people do these journals where they, every single night at the end of the day, before they go to bed, they have their weight loss goals in mind, and they look back and they say, how successful was I at my goals? Did I fulfill my goals for the day? And if they did, then they give themselves a point. And if they didn't, they don't. And you try to see how many days in a row you can meet your goals. And as you see those numbers climb, so you've done it 30 days in a row, 50 days in a row, 100 days in a row, it gives you more and more motivation to continue making those changes. The last thing we try to do is I meet with people frequently. I meet with people once a month for several months until they're on a good pattern for themselves. And then I continue to meet with them over time. And we do know that some sort of contact with a medical professional frequently, as just this little moment of accountability, really increases your success at successfully changing habits over time.
And that makes sense. And specifically, I've known people that have gone through yo-yo diets, and when they do things on their own, it's easy to get inside your own head and think, I already messed up this weight, forget it. I'm just going to eat out, go do this, go do that. I know I've been there myself. You're right. It is a lot easier when you have someone to talk to about it and to kind of counsel you on how you're doing, how you can improve, and so on and so forth.
Yeah, it's harder to fall off the wagon. It's kind of like Alcoholics Anonymous. You go to these meetings every week, and you're much more likely to stick with it than if you are just doing it by yourself and there's no level of accountability there.
Yeah, that makes a lot of sense. And so, aside from the eating, obviously exercise is going to be a part of it. How much does exercise, in your experience, play into losing weight if someone is on a healthy eating plan?
The way I teach my patients and the way I look at it is it's kind of like building a house. So the most important part of the house when you're building a house is the foundation of it, because everything else rests on that foundation. And for me, in my experience, the foundation of weight loss is your diet. If you're not changing your diet, you could exercise a lot and still struggle to lose weight. So as long as you've got that foundation pretty firm, and for the most part, you're following a good, healthy diet, then the exercise is kind of like the framework. It's kind of the framing. It gives the house shape, but it can't ever replace the foundation. Most studies seem to indicate that the average adult should get probably about 150 or more minutes per week of a moderate intensity exercise. A moderate intensity probably means a fast walk, slow jog, swimming laps, getting on an exercise bike for most people. That's pretty a moderate exercise. And if you're doing that 150 or more minutes a week, so 30 minutes 5 days a week or 40 minutes 4 days a week, you're going to be at pretty good levels of exercise. Now, as time goes on, what happens is and you lose weight, your body actually gets more efficient with the exercise and you get less bang for your buck. And so often to keep weight off, exercise then becomes even more important. And the exercise has to get longer in duration and a little more intense to be as effective as it was in the beginning when you first started. But exercise is absolutely an essential component of keeping weight off for sure, and greatly assists in getting the weight off in the first place. And, and then none of us is going to eat broccoli and salmon and nothing else for the rest of our lives. We're all going to fudge a little bit. And your exercise can really give you a lot of leeway in mitigating some of those little moments where you go to a birthday party and you have some cake and ice cream or some homemade ice cream on the 4th of July.
Or in my case, bringing ice cream, Oreo cake to my family's 4th of July event.
Exactly. Everybody does it. Everybody's going to do it. And so exercise a little bit more and it'll help you not pack on so many pounds from that delicious Oreo ice cream cake.
Yes. Absolutely. So you said with your patients, you have a lot of different things that you use as an approach. For you, what health programs have you noticed helps your patients the most?
I think it's pretty individualized, and that's one of the reasons I haven't. In my practice, I've tried to stay away from a single prescription for people because everyone's so different. But I have noticed some patterns. So if you look at, there are a lot of diets out there. There's a lot of marketing. There are a lot of bells and whistles. What actually works and what doesn't? Well, when you do studies on it, you can boil most diets down into basically 3 categories. There's the calorie, like a calorie restricted diet. So you're just eating lower calories. There is a macronutrient restricted diet. So you're altering the amount of either fat or carbohydrate that comes in. Or there's a meal replacement diet where you're replacing normal food with pre-prepared, very specific items. Like Slim Fast is kind of the big, the real popular over-the-counter version of that. And so basically all diets can be, all successful ways to lose weight can be fit into one of those 3 categories, one of those 3 diet types. And as I've gone through and seen a lot of people be successful and not successful at certain things, I have found that either 1, dramatically lowering the fat intake, so kind of a macronutrient restricted diet as a low fat. 2, dramatically reducing the amount of carbohydrate, so a very low carbohydrate, kind of almost like a keto or Atkins type diet. Or 3, the meal replacement diets, seem to be very, very successful. But those are more meant to be a short-term thing. And then after you're done with your 3 or 6 months of being on a meal replacement diet, the trick then becomes, how do we get off of that onto either just a really low-calorie diet or a macronutrient restricted diet, so that you don't just gain back all the weight that you lost. And so I found that one of those approaches usually is probably the most successful. A keto diet is really big. It's really popular right now. When you look at studies, it's no better than a low-fat diet in the long run. But I found that for most people, a keto type diet where they're really lowering their carbohydrate intake seems to be real successful, or a meal replacement diet. Those are probably the 2 most successful ways to lose weight.
You also did mention surgery. Can surgery resolve someone's health issue?
Absolutely. If you look at the studies, we feel pretty good and we feel like a therapy is effective if people lose 5 or 10% of their original body weight or more. When someone gets weight loss surgery, most of them are losing 25%, 30%, or even up to 50% of their original body weight. So I just saw a young man just this week in clinic who he was pushing 600 pounds. He got a gastric bypass surgery 1 year ago, and at this point he's lost 200 pounds so far. He still has some way to go. But you can get a lot of weight loss from a weight loss surgery. And if you look at the statistics, it's by far the most successful way to lose weight. Unfortunately, most people after weight loss surgery will gain back most or all of the weight they lost within about 10 years in general. And so there's a lot of ongoing maintenance that goes along with those weight loss surgeries. But if you need to lose dramatic weight, so this young man, he had gotten to the point where he was so obese that he couldn't breathe anymore. And he had to have a tracheostomy put into his neck so that he could breathe. And they were getting ready to take his tracheostomy out. So it's a great success story for him. And so if you have real severe medical problems because of that weight, those people are probably the best candidates for weight loss, I think.
That makes sense. Now I'm going to switch gears up a little bit here. There's a couple of, like say, for example, benign obesity that most people haven't heard of. Can you tell us about this?
Sure. So not everybody who is overweight will have the medical problems that go along with being overweight. Conversely, not everyone who has diabetes is overweight. And so there are a lot of other factors that factor into this. Oftentimes, not often, but it's not uncommon for me to see a 30-something-year-old gal. She had a couple kids. She's put on, 50 or 60 pounds. But when we draw her labs, her thyroid's fine. She's not pre-diabetic. Her blood pressure's perfect. Her cholesterol's perfect. So there are people who can gain weight and have not a single medical problem from it. Now, my personal feeling is that if they stay overweight, eventually those problems will come up. But there are people who have what we call quote unquote benign obesity. In general, I think that what is going on in that person is just their genetics. They're sticking most of their fat underneath the skin, where it causes less problems than when you stick the fat in the organs, like we talked about earlier. One actually interesting, it's kind of one of these oddball studies that I read once, but one interesting note is that despite your weight, if you're physically very active, if you exercise a lot, the body tends to pull fat out of the organs first. And so people even if they're very overweight, if they exercise heavily, they can avoid a lot of those health consequences that come along with being overweight. The particular oddball study I'm thinking about is they took sumo wrestlers who were in their active training in Japan, and they put them through these full body MRI scanners, and they could see where the fat was distributed in their bodies. And these guys were, massively overweight, 300, 400, 500-pound people. But they were exercising very intensely for 6 hours a day in their training, and they had virtually no fat inside of their organs. Metabolically, they were perfect. Their cholesterol was perfect. Their sugar, insulin was perfect. Everything was perfect. The problem was, as soon as they stopped training, even with decreasing the amount of calories they were eating, the fat just piled into their organs and they got all those comorbidities. And so you can have a lot of weight and no problem from it. And that's what we call benign obesity. And you can have a poor lifestyle and just be genetically one of those people that can eat whatever they want, never gain weight. And you can have all the problems of somebody who is 50, 60, 70 pounds overweight. And so really it comes down to just how healthy is your lifestyle, regardless of what your weight is.
Gotcha. You mentioned comorbidities. What precisely would that be?
So anything that is comorbid is something that is either caused by the original problem or made worse by the original problem. So if you're overweight and you've developed diabetes because you're overweight, that would be a comorbidity. And so it's anything that is comorbid. It comes along with it.
Ah, that makes sense. So let's change it up a little bit again. For the longest time, so this is, for me, all my life I've heard this, we were told how bad fat was for our diet. But now we're realizing, like you mentioned sugar earlier, that certain fats are good for us and the real culprit is sugar. What are some of the worst effects that sugar has on someone's health?
Yeah, that's really interesting. So when we eat sugar, or complex carbohydrates for that matter, a potato, a pasta, breads, whatever. When we eat those foods, we get a bunch of calories and our blood glucose rises. And when our blood glucose rises, our pancreas releases insulin to bring those levels of sugar down. Well, if we're constantly pummeling our bodies with these really high spikes of blood sugar and then the subsequent really high spike of insulin, after a while, a couple things happen. Just like if you drink caffeine, if you've never drank caffeine and the first time you drink caffeine, it gives you a lot of a buzz. And then if you drink it regularly, you can drink a big cup of coffee and go right to sleep. Yeah. Our body is really good at adapting to things, and it gets tolerant of things that it gets a lot of. And so the same thing happens with insulin. As we're releasing lots and lots of insulin, our body gets tolerant to it. So the insulin is now less effective. We call that diabetes. Also, insulin, its job is to take calories in the form of sugar from the bloodstream and push it into cells where it can be used as energy. Well, if you're pushing these calories into fat cells, the fat cells grow bigger and bigger, and they are metabolically not real active. And so they're not going to burn off those calories. They're going to store it. That's their job. And so when you're eating lots of high loads of sugar, it's just kind of a recipe for gaining weight. That's one of the reasons, if you think about it again with an evolutionary perspective, when do fruits, which are the original sugar, right? When do fruits come into season? It's late summer and in the fall, right before wintertime, when it's our job to eat a lot of those to store a bunch of fat so that we can make it through the winter. If you're a bear and you're going to be hibernating through the winter, you're going to eat a bunch of salmon and other things like deer and things through the spring and early summer so that you get all sorts of good muscle and protein and you're healthy. And then you hit the fall and you're gorging yourself on berries and things like that so you can put on a bunch of fat and make it through the winter. Well, the problem with our society is we have sugar in everything and we eat it every day, and it's not seasonal anymore. And in fact, it's highly addictive. And so food manufacturers will put sugar into products that you wouldn't think of as sweet, but they'll stick a bunch of sugar in there because they know that the more sugar that is in that product, the more you will buy and the more money they will make. And so sugar, it turns out, is pretty bad for us and causes a lot of these problems that we're really struggling with at this point in history.
Yeah, and especially here in the United States where we have so much and you have access to to everything.
Yeah, I lived for a couple of years in Europe, and food when I got there was pretty bland. And then I got used to it. And then I came back to the United States, and all of a sudden everything was almost sickeningly sweet, because in a lot of places around the world, they don't let food manufacturers put so much sugar into our food products. That's one of the reasons why the United States has a bigger weight problem than a lot of other places around the world.
That makes all kinds of sense. Okay, so now I want to shift our topics a little to medically managed weight loss. So For those that don't know, what is non-surgical or medically managed weight loss?
So that's what I do for a living. Basically what we do is we take people and we try to put them on a good diet for them, put them into a good exercise routine, and then we can prescribe. There are certain medications that help primarily with appetite control. And so that's what you would call medically managed weight loss. Hopefully a good weight loss physician will not just put you on appetite suppressants. They'll help you with the lifestyle changes that are necessary to keep the weight off. They will also manage your comorbid problems. So for example, when I have somebody come in, let's say that they are on 2 or 3 blood pressure medicines, they have type 2 diabetes, they're on insulin, and they want to lose weight. Well, as they lose weight, their blood pressure is going to drop. And so we're going to be having to monitor that frequently and start peeling back those blood pressure medicines as their blood pressure naturally drops. Otherwise, they'll have low blood pressure, and that can be very dangerous. The same thing with their sugars. Their sugar levels will drop a bunch, and we're going to need to start peeling back on that insulin and those other anti-diabetic drugs that they're taking so that they don't have complications of doing that. And so I usually recommend, anybody can lose weight and anybody can lose it on their own. But if you have a couple medical problems that go along with the weight, you probably ought to be following closely with a physician who specializes in weight loss, just so that they're keeping a close eye on those other things. Otherwise, I've had people after, 40 pounds of weight loss and they're on 5 blood pressure medicines come in and they're about to pass out and their blood pressure is 80/40. And we're all of a sudden peeling off their blood pressure medicines to keep them safe. And so usually if you've got a couple comorbid conditions, I say, make sure you're following along with the doctor, not just doing it on your own.
Right. So how is medically managed weight loss, how is it different from other diets?
I think it's different in one or two ways. First of all, you're getting the supervision to make sure you're doing your weight loss in a healthy way. The second, I think, is that if you are taking medications to suppress your appetite, it's going to make it a little easier to initiate and to get into the habit of some of those better dietary practices. So if you're used to eating 25 or 2,600 calories a day and you cut it down to 1,500 calories a day, boy, you're going to be hungry. And hunger, back to our evolution talk, hunger is not something our bodies and our brains are very good at ignoring, and for good reason. And so some of these appetite suppressants that we give people routinely who are trying to lose weight can make you a lot more successful, at least at first. Most of them are not meant to be a forever medication. But in the first 3 to 6 months, they can be real helpful at keeping you from falling off the wagon.
Mm. And so on that same vein, who is a good candidate for medically managed weight loss?
Specifically, anybody really who wants to lose weight is a good candidate. But specifically people who have some comorbid conditions or who have just tried a bunch and failed multiple times, because that's really demoralizing. And sometimes my job as a medical weight loss physician is more as a cheerleader than anything.
Yeah, like we talked about earlier, it's really good to have someone there kind of keeping you accountable and keeping you on the wagon.
Exactly.
And so on that note, what is the success rate for a medically managed weight loss program compared to, say, standard weight loss surgery?
Numbers wise, I don't have anything right off the top of my head, but the way to look at it is to say, how many people do you know that are on a diet right now? Basically everybody, right? Everybody you talk to is on a diet. And how many of them are successful? Probably less than 1%. And how many people are successful in a medical weight loss program? A lot more than 1%. And so I think it will really up your chances if you're really serious about losing weight and you've had some failures, especially to talk to a medical weight loss doctor.
Mm. And then finally, I have one side question for those that are curious. Obesity, obviously we have a pretty significant problem here in the States. Does obesity run in families?
Absolutely. Yeah. Genetically, everyone is just a little bit different. And you go to a big, this morning I took my kids to a parade and there were people of all shapes and sizes. And if you look at dad and then you look at their kids, you'll see a lot of similarities in body types. Also, just where you put on fat. So some people are kind of the apple shape and some people are the pear shape and a million variations on each of those. And where you store your fat, it has a big genetic component. And so not everybody's the same, comes from the same mold. Not everybody is going to look the same. And it's very genetic how predisposed you are to gain weight, and then where you'll put your weight and what medical problems will come along with that, if any. And so, yeah, there's a lot of genetic components in that. So take a look at your parents and you'll see who you are.
Well, isn't that the truth? Well, thank you so much for talking with us today, Dr. West. We really enjoyed having you share your knowledge with us about the obesity crisis.
Yeah, it was really fun. Thanks for inviting me.
Yeah, and for those of you in the audience curious about weight loss, you can find out more by searching Mountain Valley Medical Weight Loss at google.com or by visiting tannerclinic.com and clicking on the search specialty buttons and choosing the medical weight loss option, or you can reach out to them directly by calling 801-773-4840, and links will be provided in the description below. And you can also find Trial Site News on Instagram, Twitter, Facebook, and YouTube, and the links will be in the description below as well. Thanks again, everybody, for joining us, and you all have a great rest of your day. And thank you again.
Thank you.